Mrs. Peterson walked into my clinic with what looked like a simple injury on her forearm. And then 3 days later, the skin had peeled back and dried out completely. And she was terrified that she's going to need surgery. But what most seniors and caregivers don't know about skin tears is that the very treatment may be sitting in your cabinet right now that could actually make it worse or make it better. Hi, I'm Suzanne Fasella, and I'm founder of caregiverhaven.com and the Haven community where members work with me for their special challenges. For 25 years, I've helped seniors and families navigate aging as a physician assistant in geriatric care, emergency medicine, and urgent care treatments. If this video helps you, please subscribe to the channel, give it a thumbs up, and share it with someone who needs it. That's how I keep creating content like this and spreading it out to others. You walk into your mom's room, let's say, and you see her scratching her arms again. And when you look closer, there are three red patches, dry flakes, and what looks like a small tear near her elbow. I've seen this 100 times with my mom. She would reach up to scratch her arm, and I would start screaming, "Stop, stop," because she was tearing the skin and she didn't even know it. Here's what's really happening. When you turn on indoor heating, humidity in your home drops tremendously, dramatically, and that warm, dry air is going to pull moisture right out of aging skin. Think of it like leaving a sponge on the counter. Without water, it becomes brittle and cracks easily. But there's more going on. As we age, our skin naturally produces less oil. The protective barrier that kept moisture in and germs out is going to start breaking down. Add winter heating to an already aging skin, and you've got a perfect storm for serious problems. Why do we add heat? Because seniors get cold, and when they're cold, they tend to turn up their heat. When they turn up their heat, they're pulling moisture out of their skin, and the cycle, it goes around and around and around. So why does this matter? It matters because these bleeding heels and itchy rashes aren't just uncomfortable. They're warning signs that your parent's skin or your own skin barrier has failed. Once that protective layer breaks down, bacteria can enter the cracks. For someone with diabetes or poor circulation, this is going to lead to infection, which is going to lead to hospitalizations. I've seen caregivers and seniors ignore cracked heels, and then they developed ulcers there. I've watched families dismiss itching rashes as just winter skin until the scratching creates open wounds. That's when I often saw people in my emergency room or in the urgent care was with these horrible open wounds. And when I ask them what they scratched with, I won't even tell you the types of brushes they were using. These are not small problems. Aging skin loses that oil production, that natural barrier that once kept skin soft. It's barely there anymore. Without enough oil, the skin is going to become dry, tight, and prone to cracking. These cracks become entry points for that bacteria, even for fungus. Okay? So poor circulation means slow healing. And when blood decreases, blood flow decreases with age, and oxygen and nutrients don't reach the skin efficiently, guess what happens? A small scratch is going to take longer to heal for an older person than it would a younger person. Diabetes turns minor problems into emergencies because high blood sugar damages nerves and blood vessels, and you or your parent might not feel a small cut is, not even feel a small cut is developing, like a crack in the heel. But by the time you notice it, what started as dry skin has become an infected wound. Again, I've seen this in the emergency room and urgent care with diabetics. They have come in and they have taken off their shoes and their socks, and I see these gaping wounds that they didn't even know existed. What is worse is the guilt that a family member who is sitting there next to this senior feels when I've taken off the shoe and sock and I look and they go, "Oh my gosh," they turn to their mom or dad and they say, "Why didn't you tell me that this was going on?" Remember, the senior with diabetes doesn't always feel their feet. They don't know that this wound is going on. So you can't really blame them. They never knew enough to tell you. So why does all of this matter? If you or your loved one is going to take blood thinners or steroids, the skin is going to become more fragile. A simple bump against a door frame can create a skin tear that bleeds heavily, and it's going to take forever to heal. Reduced fat padding means less protection. None of us want extra fat, but when it comes to our skin, we sure would love to have some right under the skin. And wouldn't you know it, as we age, that's exactly where we lose it. That cushioning layer under the skin is going to thin with age. And without that padding, even minor pressure or friction can damage the skin. Dehydration makes everything worse, and seniors often don't feel thirsty or even when their bodies need water. Combine that with the winter's dry air, their skin becomes dehydrated from both the inside and the out now. Okay, reduced sensation is going to mean delayed treatment. Age-related nerve changes mean that a senior may not even notice their skin problems right away. What starts as a slight dryness progresses to painful cracks because they don't feel it developing. This is why I'm giving you this winter skin protection shopping list. It shows you exactly what products to buy, which ones you don't want to buy, why each one matters, and how to use them correctly. You'll find the link in the description below. But also remember that don't start any treatment, don't stop any treatment without first checking with your doctor. All this information is for educational purposes only. You must check with your physician to make sure that you are doing everything correctly based on your medical history and what your doctor knows about you. Let's go back to Mrs. Peterson. She came into my office. She had a skin tear on her forearm. She bumped into a dresser 3 days earlier. By the time I saw her, the skin flap had dried and pulled away from the bed wound. Right? So what happens is if my patients came into the office within 12 hours of ripping their skin back, I could get it back. And I'm going to explain that to you. Here is what most people don't know about treating skin tears. The key is getting the flap of the skin back over the wound quickly and keeping it moist so it can reattach. I spent nearly 30 minutes using tweezers once to gently pull the dried skin flap back over the wound. It wasn't completely dry, but even if it was, I wanted to pull it back over little by little. I could stretch it back over, especially if I put moisture over it first. The skin will absorb the water, and I can pull that skin flap back depending on when the patient came in to see me. So we stretched it back into place. But here's the critical part, the very critical part. In our office, we never recommended Neosporin. And I know that every dermatologist I ever talked to said never use Neosporin or other antibiotic ointments that dry out the wounds. What they're doing is they're protecting you against bacteria because bacteria can't live without water. But at the same time, they're drying out your wound so it can't heal either. So it's just not a good combination. Skin cannot heal without moisture. So what we would apply is mupirocin. Now, mupirocin is also known as bacitracin, and it's also a prescription known as Bactroban. So this is the only kind of cream you ever want to use. Why? Because it is antibacterial and it is a moisturizer. So it prevents infection without drying out the tissue. So you must have a tube of this. More importantly, do not get Neosporin with bacitracin. You don't want a combination cream. You want pure mupirocin cream, pure bacitracin ointment without Neosporin in it. It matters. Now, for the bandage, use nonstick gauze. Regular gauze is going to stick to the wounds and tear the healing skin when you remove it. The other thing you want to know is the cream is going to protect that wound against the gauze. So slather that cream on, put on a ton of that cream, cover that wound completely so that when you put the gauze on, no blood, no skin tissue is going to touch the gauze. okay? So that when you pull off the gauze, you're not going to pull the skin or you're not going to reopen the wound. Now, the next key is we would we put the gauze on, and then we would wrap an ace wrap, not very tight, but tight enough to hold everything in place without putting too much pressure on the wound. Why? Because we want circulation to get to that wound, so we don't want to make it real tight. And we would leave it on for 2 or 3 days without changing it because we know it's clean, we know it's protected, we know we've got the flap over it that's acting like a scab. And every time you remove that bandage, you would risk disrupting the healing process. So we just want to leave it on for 2 or 3 days, unless we see redness or pain or swelling. Then, of course, we're going to take it off. All right, then after the first few days, we would ask the patient to remove the bandage and let the wound air dry without any cream. And one of the secrets here is, how do I know when to let it air dry? Many people ask me this. Well, if you take a clean gauze and you place it on top of the wound, and then you pick it up and you look at it, if there's no liquid, whether it's clear or bloody, if there's no liquid on the gauze, that means the wound has completely sealed up. Okay, there's no oozing, so no bacteria can get in there. So we know now we can keep the wound uncovered and open to let it air dry without any cream. We don't want to moisturize anymore. There's no infection there. We want to leave it alone, let the body do its thing. And again, that skin tear may very well reattach, or it will act as a scab over the skin tear. Okay? The warning signs we need to talk about is the redness that's spreading around the edges, swelling, warmth, or pus. And that means infection, and you're going to need to call your doctor, and you're going to need immediate care. I have seen so many seniors wait. They have an infection in the leg or the arm, because that's usually where skin tears occur. And what happens is, and this is just from scratching, this isn't a spider bite, it isn't a snake bite, it isn't a finger prick or something like that. It's just because they scratched a dry piece of skin that they opened up an area for infection to get in. And what happens is with seniors is they would wait and wait and wait. And by the time they came in, many, in fact, just a couple of weeks ago, 2 of my friends ended up in the hospital for 10 days because they waited too long. You can't wait that long. You have to get in immediately. You just don't have the circulation like you used to. So, getting back to this, control the humidity in your home. Get a hygrometer, I guess it's called, to measure humidity levels. You want them between 30 and 50%. If they're lower, use a humidifier in the room where you want your loved one or you yourself spend most of your time. Switch to gentle, fragrance-free cleaners. Do not use any cleansers that have fragrance in them. They just don't do any good. Why? You're not going to smell a wound anyway. Why do you need a fragrance in it, right? So just use good old non or fragrance-free soap. If I have a wound that's somebody's coming into the emergency room and they fell and they have road gravel in their wounds, which I've seen many times, what we will do is get a squeeze bottle with a little nozzle like on it, and we do it that way. We try not to make more injury into the wound. We use the bottle and just squeeze water over it, okay? Regular soap will strip away what little oil it produces, that the skin has anyway. So we don't want to do more damage. All right. Look for moisturizing body washes designed for sensitive skin. That's what you want. You've got to re-moisturize the skin constantly, especially on seniors. Okay. Another trick to the trade is to moisturize immediately after bathing. And within 3 minutes of getting out of the shower, whether your skin is still wet, apply a thick cream or ointment while the skin is still slightly damp. This is real important because the water is going to be absorbed into the skin. The skin is going to pull the water in. And as it pulls the water in, it's also going to pull in that cream or that ointment. All right. This locks the moisture in before everything can evaporate. Now, many of you have asked me over the years, what's the difference between a lotion, a cream, or an ointment? A lotion has the most water in it. It's the thinnest, okay? It spreads on easily. A cream is a little thicker. It's going to stay on longer. An ointment, definitely the thickest. It's going to stay on the longest. When we prescribe medicines, we are very careful as to how we prescribe them, especially these derm creams, ointments, and lotions, because if we want something not so strong, we'll use a lotion. We'll write it for a lotion. If we want something really heavy and thick to do the job, we're going to use an ointment. So lotion, mostly water, cream in the middle, ointment really thick does the job. Okay? All right. Dress these wounds in soft, breathable layers. Okay? Rough fabrics are going to rub against fragile skin. We don't want to. We don't want friction. A cotton or bamboo clothing feels softer, and it has less irritation. All right. So if you have a senior that seems to be itching all the time, you're going to have to trade out their clothing. Try different types of fabrics so maybe they won't itch as much. That's what increased dryness is going to cause itching. So also increase their water intake. Don't forget about rehydration. Even if they're not thirsty, encourage regular sips throughout the day. Keep water within easy reach. You know this. We all keep glasses of water around the house. I can't tell you, I think I have 8 glasses at any one time filled with water around the house. Why? Because I grab a glass and drink it. This is the only way I do it. A lot of people have really big 18, 20, 48 ounces. I don't know, these big things that they walk around with, they carry. We've all seen them in airports, on airplanes, right? I just pick up a glass of water wherever I can find one and drink it. That's what I do. I drink a glass of water before every meal, every snack. I drink 8 ounces of water. I do never eat food without drinking at least 8 ounces of water first. Why? Because it fills me up and I eat less and then I lose weight. All right, here's what you need to remember. Winter isn't just uncomfortable for your skin, or even if you're a caregiver, your parents' skin, right? It's dangerous. The indoor heating is going to destroy humidity. We've said that. Aging skin produces almost no protective oil anymore. There's just no oil. Again, oil being that ointment, it's just not there. The combination creates the cracks, and they become infected wounds, and then seniors tend to ignore them, and then they end up where? In the hospital or my emergency room. You can protect most of these problems with simple daily care. Control humidity, use gentle cleaners, moisturize twice daily, dress in soft fabrics, and drink plenty of water. And if you find a skin tear, remember, gently pull back the skin flap using tweezers. Never use Neosporin. Use Peterson cream to keep it moist. Lather it on, cover it with a nonstick gauze, and watch, and then ace wrap it gently, and then watch for infection signs. If you see that redness, swelling, pain, or pus, you've got to get emergency immediately. I mean, don't wait on this stuff. This travels like crazy on seniors, okay? So immediately get attention. And then always check with your doctor, because this is education for educational purposes only. And I'm giving you the winter skin protection shopping list. So it's going to tell you exactly what products to buy, why each one is important, what it does, how to use it, how to protect your skin or your loved one's skin, your senior's skin, all right? Before winter does all the damage it wants to do. So it's free, so grab it below. I think it's really going to help you. And if you found this video helpful, subscribe to the channel, share the video, give it a thumbs up so it makes YouTube share it more often with others. Thanks. Take care. Bye-bye.